Good afternoon. Good afternoon and welcome to the very last Wickram's education session of 2021. Almost a full 2 years since we've officially been under a pandemic. We will be talking today about the legal issues surrounding COVID-19 vaccine requirements. So hopefully that's the session you are intending to join. My name is Shelley Nick. I'm a senior clinical risk consultant for Physicians Insurance, and I'm one of two chairs for the Wickram's Education Committee. My co-chair, Sarah McComb, and I are pleased to introduce you to our speaker today, Justin Steiner. Justin is a founding partner in Mullen, Allen, and Steiner, a Seattle firm specializing in healthcare and employment litigation. He leads the firm's employment law practice and routinely advises healthcare employers about legal compliance, risk management, and best practices. As you will soon learn, whether it's state, federal, or local employment laws, Justin knows them all. He's been a longtime friend of Physicians Insurance, and my colleagues and I can certainly attest to his expertise and ease of delivery. I think you will be very pleased with today's presentation. We are honored to have him share what I expect you will find truly valuable, his high-level summary of the moving target that we've come to know as the COVID-19 vaccine mandate requirements. Not only will he tell us about them, he will tell us what we can do and the common issues and best practices that will equip you in your work. Few housekeeping items. You are encouraged to submit questions via the chat feature on your Zoom program. You can either submit those throughout as the topics come up, or you can wait to submit those to the end. We'll reserve some time for Q&A. We're going to try to keep this casual, so if you want to submit one in the middle of the presentation, I'll find an opportunity to nudge Justin and ask your question. So however you choose to do that. One other housekeeping element that we need from you is if you will go to your image, your Zoom image, and look at the top right corner, there are 3 dots in a blue square. If you can click on those 3 dots and ensure that your full name is entered in your profile, Danielle will be able to collect our attendance. There will also be a survey sent out to you today to the email that you registered with, and we'd love it if you would return that back to us. We value that feedback and we use it for future education programs. So let your voice be heard. As always, remember to mute yourself to avoid any embarrassing moments, and you're welcome to turn off your cameras during the presentation if you would like. Without much further ado, I turn it over to Justin.
All right. Thank you, Shelley, for that introduction. I'm not sure I deserve all of that praise, but I certainly appreciate it. So like Shelley said, I have a firm in Seattle. A big part of our practice is in healthcare and advising and defending healthcare entities and providers. And for me personally, a big part of my practice is employment law. Again, specifically healthcare. So, what I'd like to talk about today is basically the different mandates that are out there. We're obviously all familiar with the Washington mandate. I want to talk about the CMS mandate as well as the OSHA emergency temporary standard. Both of those federal mandates are actually currently stayed, but I think there's some good information about those. So I'll quickly go through those, and then from there transition to talking about some of the risks and challenges that I see as an employment lawyer from all of these various issues. And it's really an interesting and challenging area because it changes constantly. As there's more medical information that becomes known, as there's changes with court decisions and other things, it's really critical for everyone, I think, to work to stay on top of it, despite how difficult that is. So starting out with the Washington Mandate Proclamation 21-14.1, to run through that, who does it apply to? It applies to individuals holding a credential who are actively providing services. It applies to individuals permitted by law to provide healthcare services without a credential, most long-term care workers, and then I think most critically for this audience, on-site workers in a healthcare setting, including employees, contractors, and volunteers. And healthcare setting is defined pretty broadly: public or private place, primarily used for delivery of in-person healthcare services. That's going to include a large amount of places, including hospitals, urgent care centers, outpatient facilities, and also mobile clinics or other vehicles where healthcare is delivered, which may be more kind of notable in a time of COVID-19 where there may be more of those mobile clinics. It does not apply to non-credentialed employees, contractors, or volunteers who don't work in the healthcare setting, meaning they work 100% remotely. But it does have to be 100% remotely. If they come into the healthcare setting any percentage of the time, then they are covered. And that's going to be consistent through the federal mandates as well. So what does the proclamation do? Obviously, it requires full vaccination against COVID-19. There is no testing alternative. And for operators of healthcare settings, really what it does is require the operators to verify vaccination status. And that is of every employee, contractor, and volunteer who works in the setting, or every employee, contractor, and volunteer who provides healthcare services for the operator. Absent proof of full vaccination, an individual can't be allowed to work. The proclamation doesn't dictate termination. An unpaid leave would be an option, but unless fully vaccinated, they can't work unless a disability or religious exemption applies. And we'll talk some more about that in a bit. Verification of vaccine status. Acceptable proof includes a vaccine card or a photo of the front and back of the card, documentation of vaccine from a provider or EHR, some other options there. For individuals who are vaccinated outside the US, there's not a lot of guidelines on that, except to say some reasonable equivalent to a vaccine card or something of that nature. Personal attestation is insufficient. We've seen in the news a lot about falsified vaccine cards, and that's certainly been an issue. I think there was news stories about Antonio Brown in the NFL and some other players who had falsified cards. Obviously an issue that you'll want to address in your policies. You'll want to have somewhere in a policy that says, obviously, no falsified cards, and then dictates the process and consequences if someone is found to have a falsified card. That it's also a risk, though, right? This issue of falsified cards. Obviously, you want to be diligent in looking at the card. If you're going to question a vaccine card, there should be some reasonable objective basis to do so. And, from an employment law perspective, a discrimination, harassment perspective, if you have managers or supervisors who are giving more scrutiny to cards of particular people, maybe someone who has expressed some religious objection to vaccines, if you have a supervisor who's scrutinizing those individuals and their cards more diligently, that's a risk of a harassment or discrimination claim. If cards of people of a particular ethnicity or national origin, again, there's a risk there. So it's going to be a theme today, but having policies in place, training people on the policies that address these various issues is really critical to address a lot of these risks that are being presented by sort of this new universe that we live in. And again, the proclamation includes a provision for disability and religious exemption and accommodation. What's interesting about that is the proclamation doesn't do anything particularly profound there. It simply recognizes that the Washington law against discrimination and federal laws like the ADA and Title VII mandate that these exemptions and accommodations be made. And so what that means is, the proclamation may say certain things as it relates to what you should do, for example, in response to a religious accommodation, but ultimately you have to comply with the laws, the Washington law against discrimination, federal law, because the proclamation is not going to overrule those things. So ultimately, you have to look at those other laws and follow really the policies that have been in place, no doubt, for a long time as it relates to exemptions and accommodations generally. So moving on to federal law, there is the CMS vaccine mandate. And I'll talk about this more in a minute. This is currently enjoined, so it is not effective at the moment, but I do want to go through it pretty quickly. Who does it apply to? It applies to staff at all facilities participating in Medicare and Medicaid programs. It also applies to staff who work off-site, such as admin offices and clinics. And again, like the Washington mandate, it does not apply to 100% remote workers who don't interact with staff or patients. What does it do? It requires facilities to establish a policy or procedure to ensure all staff is fully vaccinated. Like the Washington mandate, it does not have a testing alternative. It set deadlines for vaccination, which for our purposes are not particularly useful because we've already had to comply with the Washington mandate, and the CMS mandate is currently enjoined. Right now, whether it's the Washington mandate or various federal laws, fully vaccinated does not include boosters right now. But presumably, unless COVID magically goes away soon, which doesn't seem very likely, you have to assume that at some point fully vaccinated is going to be revised to include boosters, or depending on how long we're here, to include a second, third series of shots. Who knows? So I think what that means is all of these various issues with the mandate are really going to be ongoing. I don't think it's reasonable at this point to assume we'll deal with this now and it'll go away. I think most likely it's going to become a permanent part of our lives and our processes from an HR perspective. And again, the CMS mandate acknowledges that there are other laws which require exemptions and accommodations for disability and religion. As far as enforcement of the CMS vaccine mandate, if it does eventually become effective, CMS expects state survey agencies to conduct on-site compliance reviews of the vaccine requirements in two ways. One is the standard recertification surveys, and then the second is assessment of vaccination status of all staff on complaint surveys. And a surveyor who's on site is expected to review COVID-19 vaccination policies and procedures, making another reason why those are important. The number of cases over the previous 4 weeks, and then a list of all staff and their vaccination status. So, if this ever does become legally effective, by all accounts, CMS seems pretty serious about enforcing it. But as far as the legal status, the CMS vaccine mandate is enjoined nationwide at this point. It's sort of been an interesting route for the mandate, the CMS mandate. There was a case in the U.S. District Court of Florida where the state of Florida was asking that the mandate be enjoined. That court actually denied that request, but that was followed by a U.S. District Court in Missouri who was faced with the same request for an injunction by 10 states, and that court granted it, followed by a U.S. District Court in Louisiana who extended that injunction nationwide. So at this point, it is enjoined nationwide. It's going up to the U.S. Court of Appeals. All indications are that from there, whoever loses will take it to the Supreme Court. So not going to be a resolution of this in the near term, most likely. And CMS has confirmed that they will not enforce or implement the mandate any further while it's enjoined, which obviously puts organizations in a little bit of limbo. What do you do in the meantime? Maybe one fortunate component of us having a mandate here in Washington is that really the core of the CMS vaccine mandate we're already complying with because of the proclamation. So ultimately here in Washington, I don't know that the limbo is as big a deal as some other places. Turning next to the OSHA Emergency Temporary Standard, this was issued beginning of November. And again, it was quickly subject to various challenges in court that I'll talk about. But I did want to go through this because I think the OSHA emergency temporary standard really reflects what I would say are best practices to kind of mitigate some of the challenges from vaccine mandates and other COVID issues. Who does the emergency temporary standard apply to? Generally, all settings where any employee provides healthcare services or healthcare support services. It's likely to cover most healthcare settings, including hospitals and nursing homes. There are some exceptions to it, which I think, again, for our purposes being in Washington, are not particularly relevant because we have date. So looking through that temporary standard, there are what I saw as 7 main obligations for covered employers. And the first one is to develop a COVID-19 plan that includes policies and procedures to minimize risk of transmission to employees. That plan has to be written under OSHA. I think it says it has to be written if you have 100 or more employees, but it should be written regardless, really. The plan has to include a workplace-specific hazard assessment to identify hazards from COVID. Recognized hazards should be addressed in the plan. The plan has to include input from non-managerial employees. And the temporary standard includes the identification of at least one safety coordinator who meets specified criteria, including familiarity with infectious disease. So, you know, it's OSHA. So this emergency temporary standard has a very sort of OSHA feel to it as far as the hazard assessments and that sort of thing, which are maybe a little bit of an odd fit specifically in the context of COVID. But nonetheless, having policies and procedures which address in a very comprehensive way the risks of COVID, how the organization is addressing those, identifying the organization's legal obligations, and then giving a protocol for how to handle the various things that may come up in this whole process of vaccine mandate is just so critical, right? Because it is a bit of a moving target. Things are changing. There is a lot to know. And if you can have those good written policies that are in effect, that are being updated regularly to comply with changes, and then training your employees on it. And we'll talk about that in a minute. But that is really step number one and so important to mitigate some of the risks that we're going to talk about. And the emergency temporary standard reflects that. The temporary standard also require, or it will, if it ever becomes effective, it will require safety measures. I suspect everyone is doing these already and has been for some time. You know, limit and monitor points of entry, including screening, social distancing, PPE, cleanable or disposable barriers at fixed work locations, you know, HVAC systems that are working properly with MERV 13 or higher filters. You know, again, a very OSHA feel to these, but my suspicion is these have been going on for a long time at most workplaces. The temporary standard will also require employee health screening and medical management. Again, that's screening employees before work, which can be self-monitoring or done in person. Requiring employees to notify the employer of suspected or positive COVID-19 or specifically identified symptoms, and those are symptoms as identified by the CDC in their guidance. Follow specific criteria for those employees as far as removing them from work and managing their return to work. And that includes things like paid leave, the amount of time they need to be out, those sorts of things. And then notify potentially exposed employees within 24 hours after determining someone in the workplace is COVID-19 positive. And that issue, kind of the contact tracing and notifying potentially exposed employees, that's got some other challenges and concerns to it that we'll talk about. The ETS standard also requires employers to support vaccination, which means providing reasonable time and paid leave for folks to get vaccinated and to deal with any side effects experienced. And again, that overlaps with other laws which require the same thing. So I don't know that there's really going to be much to do there if this ETS ever gets implemented. And then the ETS requires employee training. And this is really, if policies are step 1A, training is step 1B. And ETS requires policies on COVID-19 transmission, training on the policies and procedures the employer has, training on tasks and situations which could result in infection. It requires training on available leave policies and COVID-19 related benefits. And I think that's a really good one, right? To make sure your employees know what are they entitled to as far as leave and COVID-19, such that if the employer is aware, the employees are aware, there's less chance that someone's not going to get what they're entitled to, and you're going to end up with a claim or other problem. The training would also need to identify the safety coordinator who was designated, and then how employees can access policies and procedures. And, again, the 1A, the 1B, policies and procedures are great. You need them. But if folks don't know where they are, if they can't access them, and if they're not trained on them, then you're really not going to get the full benefit. So the training is important whether the ETS is implemented eventually or not. The ETS also prohibits retaliation for anyone who sort of enforces their rights under the ETS. And there's all kinds of other laws that are also going to prohibit retaliation. The ADA, Title VII, the Washington Law Against Discrimination. I don't remember about the proclamation, but I'm sure there's something about retaliation in there. And for me, as I go through this, the retaliation component is worrisome to me. Retaliation's always worrisome to me. I think that's a place where employers can have problems, even if they're, not intentionally doing anything wrong. Retaliation claims are scary because of how easy they are to come up. And I think here, where there has become such division, right, relating to COVID and vaccines, there's such disparate camps about that. People feel so strongly about it that there absolutely is a risk, of retaliation in the workplace or harassment in the workplace relating to vaccination status or opinions about it, or anything else. So a very big issue that requires, one, again, the policies and the training, but also maybe a little extra monitoring of the workplace and the workforce. And then if something comes to your attention, handling that correctly. Does it warrant an investigation, whether internal or an external investigator? Probably. And then, following your policies once you get the results of that investigation. The temporary standard also requires employers to maintain records and engage in reporting, maintain a COVID-19 log of employees who test positive. And again, this is not effective yet. If it does become effective, then you have the issue of that log is going to contain medical information that's confidential under the ADA. So you have to limit access to that as far as who has that available to them, or risk running afoul of confidentiality rules under the ADA, which, and again, we'll talk about, but another area that really scares me as it relates to all of this. The ETS also requires maintaining all versions of the COVID-19 plans and the policies and procedures, and then reporting work-related COVID-19 hospitalizations and fatalities, again, if it becomes effective. On that note, the current legal status, on November 12th, just last month, the Fifth Circuit enacted a nationwide stay of the ETS. And in the Fifth Circuit's opinion, they fairly exhaustively laid out why they think ultimately the ETS is not going to be legally effective. Reading that opinion, I'm not sure that the ETS has much of a future, but ultimately there was a lot of nationwide challenges to the ETS, and through a lottery, the Sixth Circuit was chosen to hear those consolidated challenges, including extension of the nationwide stay. And for the Biden administration, who obviously, the ETS is sort of a core component of their strategy, the Sixth Circuit was probably not the best pull for them. The Sixth Circuit has set briefing to be completed in just a couple of days on December 10th, with a decision to follow. Again, whatever that decision is, it's very likely it'll go to the Supreme Court. So probably no outcome in the near term. And in the interim, OSHA has confirmed it will take no further steps to implement or enforce, enforce the ETS. So, having gotten through that, you obviously have this interaction of state and federal laws, and that's not uncommon in the employment law arena at all. You often have actually the interaction of local, state, and federal laws, and you have to figure out, well, what do I do to comply with all of these? In this setting of vaccine mandates, it's a little bit fortunate that the core requirements, that people be vaccinated, that you verify policies and procedures, they're pretty much the same amongst all of them. So the fact that we've complied with the Washington mandate puts us in pretty good standing with the others if they do become effective. But generally what you have to do is you have to look at each law separately, figure out what it requires, and then comply with each of them, right? And you really do need to go through the process of looking at them separately to ensure you don't have any missteps. If there is a conflict between any of them, typically federal law would preempt state law. But what federal laws do in this area is typically say that they are not in conflict with any more stringent law enacted by a local or state authority. So generally, if there is a conflict, you're going to want to apply with whatever the more stringent requirement is. But again, the best practice is to look at each law separately and ensure that you're meeting each of those requirements. So that gets us to disability-related issues. And there's really three components of that I think are concerning and an area of risk. One is the exemptions and accommodations. The second is disability-related inquiries and medical exams, which the ADA puts limits on. And then the last one is confidentiality. So for exemptions and accommodations, obviously, if an employee has a disability which prevents vaccination, they are entitled to be accommodated. And there's been no revision to the ADA or the Washington law against discrimination as it relates to this issue. The law is exactly the same as it was before COVID. And, I think probably all of your organizations have HR individuals or departments which are very familiar with and competent in addressing disability requests. And a disability request relating to COVID should be treated exactly the same. It should not be treated differently in any way. And really the process for that is, number one, recognize an accommodation request. And what that means is employees do not have to say any magic words. They don't have to say disability. They don't have to say, I need an accommodation. They can say something as simple as, my doctor said I have this condition. He's really, or she is really worried about me getting the vaccine. I don't know what to do. That information given to a supervisor is probably enough to require the employer to start the process of talking about accommodations and seeing what can be done. And that point of recognizing requests is difficult. It can be difficult, and particularly if you have a large organization with several layers of managers and supervisors between the employee and HR. Again, you've got to have those policies, and managers and supervisors have to be trained on how do you recognize an accommodation request. From there, once you have the request, you have to obtain a note from the employee's healthcare provider confirming the disability and the need for accommodation. That does not need to be particularly profound, can be pretty straightforward. From there, you engage in the interactive process, a back and forth with the employee to determine appropriate accommodations. Before the request is denied, it's really critical to consider all accommodations. consider all accommodations, combinations of accommodations. And in that sense, in the COVID-19 world, you want to rely on government guidance from public health authorities like OSHA, CDC, or DOH when deciding whether an accommodation is effective and available. And that's really good advice for all of these issues. If you are relying on current advice and guidance from a public health authority, you're probably, maybe not always, but you're probably in pretty good standing. And that relates to, what are accommodations for someone who can't get vaccinated, distancing, masking, testing, those sorts of things. So someone makes a request, you're going through the interactive process, you have to ask whether an unvaccinated employee poses a direct threat. And for my purposes, I don't think this inquiry is very helpful in the context of COVID-19. I think you can accept that an unvaccinated person in the workplace is going to pose a direct threat in a COVID world. But that's really not the question. The question is, okay, if they pose a direct threat, would a reasonable accommodation, absent undue hardship, reduce or eliminate the threat? And that's when you start talking about distancing, masking, testing, those sorts of things. And, given we've been doing those things as our mitigating measures for so long, I think the circumstances, and again, this process is very individualized, it's fact specific for each employee, but I think it's going to be incredibly rare that an organization is going to be able to say, you being unvaccinated represents a direct threat we don't have to accommodate. Not impossible, but I think it's going to be extremely rare. From there, what are those reasonable accommodations? And again, the things we're all familiar with, masking, staggered shifts is one that's a possibility. Changes to the work environment, again, these are the cleanable or disposable barriers, other things. And so as you go through reasonable accommodations, initially you're looking at what are the accommodations we can do so that someone can be physically present and continue to do their job, assuming it hasn't already been turned into a fully remote job. If you really can't accommodate that, that's not the end of the inquiry. Then the law requires you to say, well, can you move them into fully remote? Is that a possibility? If not, can you reassign them to a different position that you can better accommodate so that they can remain employed, keep working, keep getting paid, maybe some combination of remote work or reassignment. So again, I think the likelihood that someone with a disability and can't get vaccinated also can't be accommodated is pretty low, not impossible, certainly, but pretty low ultimately. There is no obligation to offer accommodation which imposes an undue hardship. And undue hardship means significant difficulty or expense. And that analysis is going to change depending on your organization, right? If you have an organization with 100 employees total, what is significant to you is going to be vastly different from an organization that has 10,000 employees and multiple locations. But regardless, what constitutes an undue hardship is really a stringent standard. I mean, the law is really geared towards, let's figure out how someone with a disability can keep working. And so it is a very stringent standard. And again, even if you can't accommodate them working in their current position or working on site, you still have to look at remote work. You still have to look at reassignment. So from my perspective, and this was the same before COVID, it'll be the same after COVID, it is risky to rely on undue hardship to not accommodate someone because it is a tough standard. And even if someone has a good basis for it, where they can fall down is, not being able to prove it up later in a clear, detailed, and documented manner. So if you are going to rely on this, one, I would say maybe talk to your legal counsel first, but also be able to prove that up in a really clear, detailed, and documented manner that you do contemporaneously. So you don't have to try and recreate it afterwards. All right, moving on to disability-related inquiries and medical exams. The ADA has limits on disability-related inquiries and medical exams depending on the stage. So generally, it does not allow disability-related inquiries or medical exams prior to making a conditional offer of employment. Once there is a conditional job offer made, you can make those inquiries and require those exams if they're required of all entering employees. And then after employment begins, you can do those things if they are job-related and consistent with business necessity. So the question that this raises on the first point, no disability-related inquiries or medical exams prior to making a conditional offer of employment, is when you have an applicant, can you say to them, are you vaccinated? Or is that a disability-related inquiry? The EEOC has given us guidance on that and said the very narrow question of, are you vaccinated, is not a disability-related inquiry. But the risk is, once you ask that question, it potentially elicits follow-up questions that would be disability-related inquiries, or it can elicit information. Like if someone answers in an interview and says, well, no, I've got a disability. Well, then you've got information you're not supposed to have. And you run the risk of, you decide not to hire that person. It creates the possibility of them saying, well, the reason you chose not to hire me is because you learned I have a disability, that I can't get vaccinated. But obviously, right, you want to make some inquiry, you want to have some information. And so I think the best approach to that, as it relates to what do you do with applicants before a conditional job offer, is you don't ask them a question. Instead, what you do, and you can do it in writing, you can do it verbally, I think writing is better, is just say, our policy is all job offers are conditional on proof of vaccination. Specifically say, do not provide us any information about your vaccination status, right? But you're apprising them of the policy so that the applicant knows, okay, if we go forward, I'm going to have to show this. Then once you make that conditional job offer, as long as you're doing it for all applicants, then you can ask and make some disability related inquiries and get into that information some. But an area of risk to have those discussions before a conditional job offer is made. So some other matters related to disability related inquiries. Employers, the EEOC has given guidance. Employers may ask employees if they are experiencing COVID-19 symptoms, whether that's in response to an employee calling in sick or screening. When an employee returns to work, you can get a fitness for duty note. And testing administered by employers, again, like I said, as long as it's consistent with current public health guidance, the EEOC has said that will meet the ADA's business necessity standard. But again, you've got to comply with public health guidance, right? If you go above and beyond and you're requiring a lot more than the guidance says, then you've got a problem of that not meeting the standard and being an inappropriate medical exam. One interesting point, and I think this is still current as far as I could find, an antibody test, as opposed to a viral test, constitutes a medical exam under the ADA. And in light of the CDC's interim guidelines that antibody test results should not be used to make decisions about returning persons to the workplace, an antibody test at this time does not meet the ADA's job-related and consistent with business necessity standard, so that requiring antibody testing before allowing employees to re-enter the workplace is actually not allowed under the ADA. And that is noted in very recent guidance from the EEOC. So I certainly would not profess to be terribly knowledgeable about the kind of scientific nature of antibody tests or viral tests, but an important point to know for employers who are doing testing. Some other potential areas, if you have policies where you're screening or testing everyone based on set criteria, you're pretty good. And that's consistent in employment law generally. If what you're doing applies to everyone, then you're probably okay, right? You're not singling anyone out. But if an employer wants to screen or test a particular employee, the ADA requires a reasonable belief based on objective evidence that the employee may have COVID-19. And I think this is an area of particular risk, right? If you have a supervisor, say you have an employee who has expressed verbally in the workplace some religious objections to the vaccine, or perhaps, they have disclosed, right? We have the Omicron variant, which I think originated in South Africa. Maybe they disclose they have a family member living with them who's from South Africa. And suddenly the supervisor, wants to question them or wants to test them, not because it's part of a policy for everyone, but because of their association with someone from South Africa, a family member specifically. Then you've got a risk of, all right, are you singling them out based on a protected characteristic? And that's a risk. So again, you want to have your policies and train your supervisors that it's not a free-for-all. Employers may ask employees why he or she was absent from work. Employers are always entitled to know that. Kind of related to disability is the Genetic Information and Non-Discrimination Act, commonly referred to as GINA, prohibits employers from asking employees medical questions about family members, right? So an employer can't ask an employee if they have any family members with COVID-19 or associated symptoms. What GINA doesn't prohibit is saying to an employee, have you had contact with anyone with COVID-19 or associated symptoms? So a bit of a semantic difference, but if the question is specific to family members, that's going to violate GINA. So important to know. Confidentiality of vaccine status, generally, and this has been for a long time, the ADA requires employers to keep confidential any medical information about an employee. And that includes if an employee has requested or is receiving a reasonable accommodation. And that medical information has to be kept confidential, has to be kept in a separate file from the personnel file. And I think this is really a big area of risk. And again, I think a large part of that is because people have such strong feelings about it. But you can imagine a scenario in the workplace where someone's requested or receiving an accommodation, that upsets someone, they share the information, it becomes known, the potential for not only violating the ADA as far as confidentiality, but harassment and retaliation and those sorts of things. So for example, an employer knows that an employee is teleworking because they have COVID-19 or symptoms associated with it, so they're self-quarantining. May the employer tell staff that the employee is teleworking without saying why? Yes, if staff need to know how to contact the employee and the employee is working, then you can say that the employee is teleworking without saying why. Similarly, if an employee is on leave rather than teleworking, you can disclose that they're on leave, but you cannot say why. That would violate the ADA. Another example, if a manager learns an employee has COVID-19 or associated symptoms, does the ADA prevent the manager reporting it? No, right? The manager can report the identity and specifics to a designated representative of the employer. And really that should be per policy. What does the policy say do in those circumstances? Because what you definitely don't want is that supervisor to learn the information and then start wandering around to other employees. Hey, have you had any contact with Danny? We're worried she has COVID. Have you talked to Danny? Uh-oh, you might have COVID. We think she has COVID. You definitely don't want that, right? That's gonna subject you to risk. But if the information goes to the designated person, they can interview the employee, figure out who they contacted for notification purposes. The notification, obviously, you can't name the employee. You can use generic descriptors, someone on the 4th floor, something like that. Obviously employees talk and they try to figure these things out. And a lot of times they will figure it out. And so be it. But the employer can't confirm anything if employees are asking about it. So again, this confidentiality issue of keeping requests for accommodation, medical issues, what accommodations are being given and why, it's a really tough area because COVID is so prominent right now. There's such strong opinions about it. What can you do to mitigate those risks of confidentiality breaches? Again, assess your policies and procedures. Make sure you have comprehensive policies which comply with law. Train folks on what the obligations are, what the no-nos are, and what they need to do in certain situations. And again, then, monitor the workforce a little bit more maybe than before COVID, just to make sure folks are doing the right thing. And again, if you do get information about a potential breach, handle that the right way with an investigation and appropriate remedial action. So turning to religious exemptions, again, if someone has a sincerely held religious belief, they may be entitled to an exemption, unless doing so would an exemption and accommodations, unless doing so would be an undue hardship, with an undue hardship defined as more than a de minimis cost or burden to the organization or its operations. So again, the EEOC very recently did guidance on religious accommodations that are worth a read. The takeaways for me from it were, ultimately, is the person requesting an accommodation based on a sincerely held religious belief or a personal reason, political, social, economic? That's really the first core question that you're trying to figure out. Again, in that scenario, there are no magic words required, which means you got to train supervisors to recognize what's going on. And this is the way requests for a religious accommodation have always worked, and they still work this way, is whether or not someone's belief is sincerely held, there's really no objective measure for that. And that's what courts have said. And so courts have said, you need to assume sincerity unless you have an objective basis for questioning it, right? Otherwise, you've got to assume sincerity. So to the extent you have an employee who articulates a religious basis, that's clearly not just a personal choice, political or whatever, you've got to assume sincerity and give it to them at that point. Certainly you can ask for information, and that's the best way to do it. Have a form where they write out what is the belief and how does it conflict with the mandate, and then rely on that, right? So if what they write is, well, I think the Constitution protects me, or I want to wait a year before I really think this is safe, those are not religious reasons. Once they write them, rely on them, and fine, call it personal choice. But if they articulate a genuine religious basis, then yeah, you got to accept that at that point.
Jenna?
One issue I heard from a lot of folks when I got calls about this was, prior inconsistent conduct. So maybe someone got vaccines previously. That's certainly something you can consider, but it's not a determining factor. The EEOC and the courts have said beliefs may change over time. So you can't just rely on that prior inconsistent conduct. Ultimately, most religious accommodation requests will hinge on whether it imposes an undue hardship. And again, like I talked about with disability, that's a really high burden to meet. I think it's going to be quite rare. And again, each request is specific and fact-based. So 3 steps to respond to religious accommodations. You need to decide if it's personal choice or a sincerely held religious belief. Is there a good faith and objective basis to question it? Don't jump to personal choice too quickly. And again, request information and documentation that you can rely on. Before you make a decision, engage in the interactive process. Figure out, can we accommodate this? Is it really going to be that difficult? If not, lean towards granting it, and then ultimately make a decision. Now, about making a decision, that conclusion and the accommodations, that can change over time. If we get in a situation, God forbid, right, that there's another wave and there's a lot of cases and it's a worse variant, well, right, what's a reasonable accommodation in that setting is going to be very different from where we are today. But ultimately document the process thoroughly. If you decide no, again, you're going to have to explain why distancing, masking, testing, remote work, those sorts of things is not possible. And that's going to be tough in most situations. Very quickly here, vaccine encouragement. A lot of healthcare organizations in particular may have programs and campaigns to promote vaccines. That's fine. The one risk is for people who have a disability, a medical exemption, a religious exemption. There is the risk that at some point encouragement turns into harassment. So just something to be aware of, that there is a line there. And you want to be cognizant of that as you promote vaccines and those sorts of things. So again, just to wrap up here, I do see really a lot of risks of potential retaliation, discrimination, harassment claims in this venue, in this setting with these issues. The first and perhaps biggest is handling those requests for accommodation. And I think the best thing I can say there is handle those as you've always handled those. And if you've got people who are trained and understand the obligations, you should be in good stead. The breaches of confidentiality, that's really a big one. I think that's something to be specifically concerned about. Reacquaint yourself with the obligations so that you don't fall down there. And then the last big one is, again, social attitudes, just the idea that this has become so divisive, people feel so strongly about it, and the risks you have in the workplace of people talking about, saying things they shouldn't say, the harassment, the retaliation for people who have different thoughts. And I think the best you can do there is a little extra monitoring of the workplace. So I will close there. I apologize. It's a robust issue. I didn't leave a lot of time for questions, but certainly if anyone does have any questions from the presentation, I'll put my email address as Michael wraps up in the chat box, and please feel free to email me or even call me. I'm happy to answer those questions afterwards. So thank you.
All right, thank you, Justin. I think we have, if there's any questions immediately pending, I think we have a couple of minutes here. If people want to drop them into the chat box, feel free to do so. I'll monitor that a little bit while and we did get one question here, Justin, about if the slides will be made available. I'm
happy to make the slides available. I'll send those to Shelley, no problem.
Great. And then Shelley or I can forward those on to everybody else too. Appreciate that, Justin. And I do want to thank you. That was a great presentation. Obviously, this is this is a topic that is so pertinent right now with everything that's going on, and really appreciate your clear and concise presentation on it. Also want to thank Shelley and Sarah for putting this thing together today. And I want to thank all of our members for participating. As Shelley said, you're going to get a survey in your email, should be today. And if you could go ahead and complete that, And then we'll make sure that you get your, the CE credit has been approved and the MCLE credit for attorneys is pending, but I do anticipate that being approved here soon as well. And so we'll go ahead and submit all those. Real quick, just a couple of announcements for our WICRMS members. We have, I sent out an email on this, but we do have a topic submission form on our website. You want to go to wicrms.com and then click the resources tab and then the education submission link on the left of the resources page. And that way you can submit potential topics for us to have future education sessions on, or potentially at our conference, at our annual conference too. This is a great way for us to get feedback from everybody. And it's a great way for us to help make this a more beneficial membership for all of you. So we encourage participation. Alternatively, you're always free to email admin@wicrms.com or me. And I'm happy to bring all these up for topics at our board meetings. We also anticipate having another education session. This is penciled in for late January. We wanted to try to do something after the holidays, but not too close to anything. And so you'll be getting some details on that here in the next several weeks. We're also dipping our toe back into having a social event, and we wanted to provide our members with the opportunity to engage in some networking if that's something that they're interested in, or just a chance to get out and discuss relevant topics amongst each other and amongst some of our cohorts in this industry. And we're looking at sometime in early February to do that sometime in downtown Seattle. We may send out a survey about that for potential dates. So if that's something that you're interested in, please respond, and we'll try to accommodate as many people as we can by putting it on a date where as many people as possible can attend. Again, we'll be sending out some details here in the next several weeks, but please keep that in mind. Lastly, I just want to close up and thank everyone for their attention and for participation today. It was a great presentation. I hope everybody found it valuable. And thanks again. We look forward to seeing you in the new year, and have a wonderful holiday season. Thank you.
Michael,
Yes.
if I could just interrupt for just a second, we did have one last minute question slide in from Martha Raymond. And that question's for Justin. I realize some people may already have to go, but if you want to stay and hear it, the question is, what if your employee tells fellow employees that he or she has an accommodation and then claims you leaked it?
Yeah, I think in that situation, number one, it would be important for, supervisors, managers, employer representatives, not to confirm, whatever the information is. Then I think I would document, whether that's email from the employees that the employee told the information to, but some documentation contemporaneous that you can go back to and say, yeah, no, the employee shared this information. We didn't share it. We didn't confirm it. And I think as long as you get that information at the time, you're going to be pretty well protected. I mean, obviously, if an employee is sharing the information, not the employer, that the employer hasn't done anything, but you are going to want to take the time to get some documentation, something contemporaneous to show that.
Great, thank you. Thank you. Any other last minute questions that folks want to present? We are winding down, and I don't see anything unless I've missed it. Lots of thank yous and lots of requests for the slides. So I think you covered it perfectly.
Good.
Thanks, Justin. Really appreciate it. And thank you, everybody, for attending.
All right.